Cystic fibrosis is a genetic condition that primarily affects the body's exocrine glands, which are responsible for producing mucus, sweat, and digestive fluids. Normally, these fluids and mucus in your body should be thin and slippery, kind of like a lubricant that protects your tissue and helps things move smoothly. But in people with CF, there's a genetic mutation that causes these secretions to become thick and sticky. So instead of flowing smoothly, this abnormal thick mucus builds up and causes problems throughout the body, but it mainly affects the lungs and digestive system. Imagine trying to breathe through a straw filled with honey. That's somewhat similar to what people with CF experience in their airways. In the digestive system, it's like having thick glue blocking the paths where digestive enzymes should flow freely. Cystic fibrosis is one of the most common life-threatening genetic conditions, affecting approximately 70,000 people worldwide, with around 30,000 cases in the United States alone. It occurs in about 1 in every 2,500 to 3,500 newborns, predominantly in individuals of European descent. Causes of cystic fibrosis. Cystic fibrosis is caused by mutations in the CFTR, cystic fibrosis transmembrane conductance regulator gene. This gene provides instructions for making a protein that acts like a gateway for salt and water to move in and out of cells. When the gene is mutated, this protein doesn't work properly, and the mucus becomes thick and sticky. Cystic fibrosis is an inherited condition, meaning it's passed down through families. It follows what we call an autosomal recessive pattern. This means you need to inherit a faulty gene from both parents to develop CF. If you only get one faulty gene, you become a carrier but won't have the condition yourself. When both parents are carriers, each child has a 25% chance of having CF, a 50% chance of being a carrier, and a 25% chance of neither having CF nor being a carrier. This is why CF can sometimes appear in families with no previous history of the condition. Symptoms of cystic fibrosis. The symptoms of cystic fibrosis can vary depending on the severity of the disease and the organs it affects. Most people experience a combination of respiratory, digestive, and systemic symptoms. In the respiratory system, people with CF often describe feeling like they're breathing through a narrow tube. The thick mucus in their lungs makes them cough frequently, not just a light cough, but deep, productive coughs that can be exhausting. This mucus also traps bacteria, leading to frequent lung infections that can feel like having a bad chest cold that won't go away. Over time, the buildup of mucus and inflammation damages lung tissue, leading to reduced lung function and a feeling of shortness of breath even during simple activities. In the digestive system, cystic fibrosis impairs the pancreas's ability to release enzymes necessary for breaking down food. This results in poor absorption of nutrients, leading to malnutrition, weight loss, and bulky, greasy stools. The constant struggle to maintain weight and energy levels can feel exhausting, particularly for children who are trying to grow and develop. Many people with CF feel tired more easily than others. Simple activities like climbing stairs or walking long distances can leave them short of breath. They might notice their skin tastes salty due to problems with salt balance in their sweat. Men with CF often face fertility issues, while women might have more difficulty getting pregnant. The thick mucus can affect reproductive organs too. Diagnosis of cystic fibrosis. Diagnosing CF typically starts early in life, thanks to newborn screening programs in many countries. A blood test checks for elevated levels of a protein called immunoreactive trypsinogen, which can indicate CF. If this initial test suggests the possibility of cystic fibrosis, further testing is performed. The sweat test is a key diagnostic tool. It measures the amount of salt in the sweat, as people with CF typically have higher than normal levels. This painless test involves applying a small amount of stimulation to the skin to induce sweating, which is then analyzed in a lab. Genetic testing can confirm the diagnosis by identifying mutations in the CFTR gene. This is particularly useful for people with atypical symptoms or a family history of CF. In some cases, additional tests like chest X-rays, lung function tests, or stool analysis may be used to assess the extent of the disease and its impact on the body. Treatment for cystic fibrosis. Unfortunately, there is no cure for cystic fibrosis. However, advances in treatment have made it possible for people with CF to live longer and healthier lives. Here are the main treatments. Number 1. Airway clearance. This is crucial for keeping the lungs healthy. People with CF need to do special breathing exercises and physical techniques to help clear mucus from their lungs. Many use devices like the vest therapy system, which vibrates the chest to loosen mucus, or handheld devices that create resistance when breathing out. These typically need to be done multiple times a day. So try to create a regular schedule for airway clearance and stick to it. Many people find it helpful to do sessions while watching TV or listening to podcasts to make the time pass more enjoyably. Number 2. Medications. Various medications are used to manage CF, including bronchodilators. These help relax the muscles around the airways, making it easier to breathe. Mucolytics. These medications thin mucus, making it easier to clear from the lungs. Antibiotics. Used to treat and prevent lung infections, antibiotics may be taken orally, intravenously, or inhaled. CFTR modulators. These newer drugs target the underlying genetic defect in CF, improving the function of the faulty CFTR protein in some people. Number 3. Nutritional support. Since CF affects digestion, people with the condition need more calories than others, sometimes 1.5 to 2 times more. They also need extra salt, especially in hot weather or during exercise. A high-protein, high-fat diet is usually recommended, along with taking pancreatic enzymes with meals to help with digestion. So, keep high-calorie snacks handy and always carry salt tablets or salty snacks, especially during physical activity. Many people find it helpful to add salt to their foods and drinks. Number 4. Exercise. Regular exercise is incredibly important for people with CF. It helps clear mucus from the lungs and maintains overall health. The key is finding activities that you enjoy and can sustain long-term. Start slowly and build up gradually. Swimming is excellent because the humid environment can help with breathing, but any activity you enjoy is good. Number 5. Infection prevention. People with CF need to be extra careful about avoiding infections. This means regular hand washing, avoiding close contact with others who have colds or infections, and staying away from stagnant water or moldy environments. Try to keep hand sanitizer with you and don't be shy about asking people to wash their hands or wear a mask if they're sick. Number 6. Surgery. In advanced cases, surgery may be necessary. This can include procedures to remove nasal polyps, insert feeding tubes, or, in severe cases, a lung transplant. Prognosis. The prognosis for cystic fibrosis has improved significantly over the years. In the past, cystic fibrosis was often considered a childhood condition due to the limited life expectancy. However, with modern therapies, many individuals now live well into adulthood, with some reaching their 40s, 50s, or even beyond. While cystic fibrosis remains a progressive condition, meaning symptoms tend to worsen over time, the severity and rate of progression vary widely between individuals. Those who receive consistent medical care, follow their treatment plans, and take proactive steps to prevent complications generally have better outcomes. The field of CF treatment is constantly evolving, with new medications and therapies being developed. The most exciting recent developments are CFTR modulators, which can dramatically improve symptoms for many people with CF. Now, we want to hear from you. Do you or a loved one live with cystic fibrosis? What has been the most effective treatment or strategy in managing the condition? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.